Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Christie Mulholland. She's a palliative care physician. Today's Kevin MD article is Reclaiming Physician Agency in a Broken System. Christie, welcome to the show.
Hi, Kevin. Thank you so much for having me.
All right, so let's start by briefly sharing your story, then we'll jump right into your Kevin MD article.
Awesome. So, as you said, I'm a palliative care physician. I'm also a certified physician coach, and I'm also the director for the Faculty Wellbeing Champions program at my health system, which is Mount Sinai in New York City.
All right, so as the champion for physician well-being, just tell us about some of the things that you currently do under that role.
So, I work with faculty well-being champions from all across the health system, every specialty. And each one of them is really passionate about well-being, and they're working on different initiatives within their own departments to try and do things that we know can help with well-being. Things like reducing clerical
Hmm.
burdens, reducing charting time, increasing access to mental health services, a whole range of things. And I support them and their department chairs in developing and executing these initiatives.
Your Kevin MD article is titled Reclaiming Physician Agency in a Broken System. For those who didn't get a chance to read your article, tell us what it's about.
So, this article was really my reaction to an article that I found recently in The Lancet in October 2025. It's written by Adam Gaffney and his colleagues, and it's called Healthcare in the USA Money Has Become the Mission.
Hmm.
When I read this article, it really spoke to the exact experience that I'd been having and that I hear talking with other doctors. Specifically, there was one line that really grabbed my attention, and it was about how doctors feel demoralized as we try to do good work in a bad system. So I knew that that was exactly where I wanted to explore further because we can't just stop at describing how bad the problem is and how bleak the situation is. I wanted to delve more into what can we all do as physicians when we
Hmm.
are trying to exist within that reality and do as much good work as possible. And specifically, I had gone through my own personal experience recently navigating, I call it my disillusionment. Some might describe it as burnout. But a few months ago, I had really reached my own personal limit with continuing to work in the way that I had been within that bad system or that broken system. So I made big career changes. I took a sabbatical. I'm now part-time and I'm developing my coaching practice.
Hmm.
This article spoke to me for a number of reasons. Interestingly, I also pitched this article for a journal club at work. And at the end of the day, we decided to go a different direction and talk about a different article. We didn't want to risk leaving a group of doctors just feeling demoralized and feeling like, well, what are we supposed to do with this information? So we picked a different article that kind of focused on something a little more realistic that we could change in the short term while working within the system. But I still felt like I wanted to talk about this article with other
Yeah.
doctors. And so writing my article was my way of starting a conversation. And I hope a lot of people listening today are interested in keeping this conversation going.
So, what in particular about that Lancet article resonated with you?
That article described in detail, in stark detail, how corporatized healthcare has become in our country. And the result is patients are no longer at the center of healthcare, but really profit is. And even working at a really wonderful department and a wonderful health system, there are forces acting that are beyond my control, beyond my boss's control, beyond my boss's boss's control. We're answering to corporate interests. We're answering to insurance companies, which are for profit. And that is resulting in, it's a very difficult environment to live up to our own standards for good care.
And when the fellow physicians at your journal club passed on the article and want to talk about something else, how did you feel about that?
I understood. I didn't put up too much of a fight because, part of what I write about in my article is there are certain things that were powerful to do inside of the system and changes that we can advocate for inside. And then there are conversations or maybe advocacy work that we need to do from the outside.
Hmm.
So that made sense to me that when you're on the inside, you're constrained in certain ways, but there's still a lot of great advocacy work that you can do just for the patient sitting in front of you. For example, when I document in my patient's chart, I'm not going to say this patient is non-compliant or non-adherent with their medication, but what I'm going to write is patient did not take the medication because their prescription plan wouldn't cover it,
Hmm.
or they stopped covering it. So what I'm looking to do is empower people to do the change, do the work that they can from the position they have. But if they feel that that position becomes too limiting for them, or they feel like they're not able to act in alignment with their values, then that might signal that they have to make a bigger change for their own lives.
One of the themes in your article, of course, is physician agency and how that's been eroded working in a medical system that is increasingly being corporatized, right? So give us more detail in terms of what exactly that means, or how are you seeing that play out?
Hmm. And this is the central question, really. So thank you for asking. But I think there are perhaps two things happening. One is that our agency actually is being eroded
Hmm.
because I've felt these changes even over the course of my career. I used to be more powerful to make an impact on my patients' lives when I started out. And over time, as this squeeze happens or this corporatization has happened, I do feel real ways in which my agency or my impact has been eroded. I try very hard in hospice and palliative medicine to help patients have the end of life that they hope to have. Patients that decide they want to die at home, and I set them up with home hospice services. And over the years, I've just noticed more and more that these patients, they wind up in the emergency department, not because they wanted to be there, but
Hmm.
because their hospice didn't have adequate staffing or adequate resources. So all that work that I've been trained to do and that I do remarkably well, it doesn't matter when, the resources aren't there to meet the patients at home. So that's the first part is we have lost some agency and some power. But I think the other is really a limiting belief that a lot of us working in healthcare have that we forget that how much agency we do have, or we lose touch with it. We tell ourselves stories that limit us more than we need to be limited. So one example is silos. When we work within silos, my silo is academic medicine.
Hmm.
I trained in academic medicine. Those were the attendings that I worked with coming up, and I wound up working in an academic department. So when you're only surrounded by other people that are practicing medicine the exact same way as you only have a narrow perspective. But when you actually remember that you have choice and you have agency, and there are all kinds of doctors practicing in different ways and different models, then you remember that you have that agency and you can tap back into it, and that can really empower doctors to make changes.
So, what are some ways to tap back into that agency? You mentioned in your article the concept of physician unions, and I know that in various parts of the country, I live just north of Boston, so I know that there's a lot of organized physician unions in Boston, and you talk about that as a potential way where we can tap back into our agency. So, talk more about that.
Yeah, that's such a great example, and it's a powerful one because it requires some courage to join a union. And it also is powerful because it brings doctors together
Hmm.
in numbers doing collective action. And I do think at the end of the day, if the system is going to change, that's the power that we need is the strength that we have in numbers. But even before we get to that step, when I think about agency, I think the key is doing your own individual work of discerning where do I want to stand in relation to this broken system. And that individual work can take you from just passively participating in this system, doing things the same way you always have, to making different choices. Those different choices, you're choosing with your eyes open. Maybe you end up coming to the conclusion, you know what, I have student loans. I can't make a big change right now. I have to stay
Hmm.
working where I'm working. but what's one small change that I can start making to advocate more for my patients within my role, right? How can I game this prior authorization battle so I can win more of them? How do I draw my own boundaries for work-life balance? Maybe I'm going to do a negotiation so that I don't have to take as much call.
Hmm.
So agency doesn't necessarily mean I'm going from where I am to joining a union tomorrow. But I think it really starts with that individual work of teasing out what are my real options, laying them all out, figuring out which things are actual limitations on how you can act, and which things are more like limiting beliefs that you're holding yourself back.
So you're saying that depending on each physician's individual situation, and you gave the example of perhaps a newly graduated physician with hundreds of thousands of dollars of medical school loans, they may be in a different position to push back or set boundaries versus a physician who may be in a little bit of a different financial situation or a different part of their career.
That's absolutely right. But that doesn't mean that they're powerless. If you're a resident or you're a junior attending, you might have fewer options, but you can still do the work of consciously understanding for yourself, where do I want to be and what are my options to get there? Where's the way forward? So if you can change from having the perspective that, wow, things are horrible and I'm stuck and it's forever, but if you can move yourself into, well, here's my timeline, right? I have 7 more years left on these loans. Here's what I can do in the meantime. And maybe there's a mentor that I can start connecting with that will help me find ways to make these next 7 years more sustainable. Maybe I'll join the faculty well-being program. Maybe I'll start working with a coach or a therapist. You could still make incremental changes for yourself, even though you're right, Kevin, you can't make all the changes all at once.
You work at a large academic medical center, so tell me what the climate is there, because one of the scenarios you mentioned where some physicians may feel stuck in a job that is increasingly encroaching on their autonomy, right? That to me sounds like a path to burnout, right? So the physicians that you see, your colleagues, what are their perspectives? Are they seeing things the same way that we're describing? Are they trying to find ways to retain or reclaim some of their agency?
I work with some really wonderful doctors and the well-being champions in particular. I think they're so passionate and they're so motivated to do more and go beyond just the work of getting through the day and seeing the patients. So yes, people find their own ways to make an impact where they can and where they're passionate. When I see physicians that come to coaching, oftentimes they are the ones that feel a little more stuck or a
Hmm.
little more trapped by this system. And their presenting problem might actually not be healthcare in the USA, money is the mission. It sounds like something else. It sounds like I'm really struggling with work-life balance,
Yeah.
you know? I can't get my charts done in time and I'm not getting home to my families. So it may present as a different sounding problem, but a lot of this distress can be traced back to the way that the system is and all of the many ways that it impacts the culture of healthcare and individual well-being.
Tell us the type of questions a physician should ask themselves, no matter where they are in their career or financial or personal situation, so they don't get stuck. What kind of questions should they be asking themselves?
Well, the questions that are coming up for me, well, first, before I go into the questions, when you mention about avoiding getting stuck or, avoiding burnout, a lot of people think that they're going to avoid burnout in their careers or that that's the goal. The way that I think about it is it's a reality. We are all going to experience burnout that comes and goes, and we might feel stuck at different points in our career. That this is a practice we
Hmm.
need to have for ourselves rather than just having a foolproof system. That's not realistic. So that's first. But there are some great coaching questions that can help people move from a place of being stuck to getting unstuck.
Hmm.
The GROW model is one coaching framework So G stands for goal. What's the goal? What is my goal for this coaching session today? Or, what is the goal for the next 1 year of my
Hmm.
career? R stands for reality. So, what is my current reality? What's the reality of the situation? I think that Lancet article is a very bleak description of the reality of the whole system. But what's my reality? Am I in debt, or have I gotten past that milestone and now I have a little more financial autonomy? Do I have the freedom to go part-time or pursue a different kind of practice? So that's R. And then O stands for options. This is really laying out the options of what you could do to make a change. And I go into that in the article, the sort of four pathways that
Hmm.
doctors are finding to take more agency for themselves. And then W stands for the way forward. Where do I want to go next? I might not have the whole blueprint, but I need to figure out the next step so I can move forward.
We're talking to Christie Mulholland. She's a palliative care physician. Today's Kevin MD article is Reclaiming Physician Agency in a Broken System. Christie, let's end with some take home messages that you want to leave with the Kevin MD audience.
So I think the biggest take-home message for your audience, Kevin, is that we have more power than we think. We might forget, but we do have agency already. And the more of us individual physicians that reclaim that agency for ourselves and our own careers, the closer we are to that collective power where we're all working together to change some things that we all know need to change in the system.
Christie, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you so much for having me, Kevin.